Information on this show is provided for informational purposes only and is not meant to replace the advice of your own physician or other medical professionals. It should not be used for diagnosing or treating a health problem or disease. If you suspect you have a medical problem, promptly seek help from a healthcare provider. Advice is free. Toothbrush and toothpaste not included.
If you have an infection going on inside your mouth for years that is symptom-free, and you're dumping pus into your bloodstream for not just weeks or months, but literally for decades, do you think that can have some effect on your overall health? Man, absolutely.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hey, welcome. We are so glad that you're able to join us. I'm Suzanne Lynn. I'm the host of Your Filthy Mouth and the star of the show. I know that embarrasses you, but Dr. Chuck. And Dr. Chuck, we've been planning this for a long time, and here we are, the inaugural kickoff of Your Filthy Mouth. I feel like we should be toasting with champagne or something. But we're glad that you're here. And before we jump into what your mission is and what you're so passionate about, let's find out more about who you are and what's brought you here.
Well, I'm Chuck Reinertson. I'm a dentist. I've been practicing in Central Florida since 1979, so that's about 39 years now. And dentistry has changed a bunch since I've been in practice. The way we were taught in dental school is completely different today. Back then, when you went to a dentist and you had yellow teeth, the dentist would tell you, well, what you can do for yellow teeth is you wear a brown tie.
Oh my, that's changed a lot.
Yeah, today it's pretty much how do you want it? How do you want it?
Sure.
And one of the things, we went through a cosmetic phase here in the early 2000s where the economy was good, people wanted better smiles, which is great. But a few years ago, I went to a course that started connecting the dots between what happens in the mouth and what happens in the rest of the body. And it just blew me away. So many systemic issues have the origins in the mouth. And that changed my focus in dentistry from cosmetic, which we still do, and replacing teeth, but you have to get the right order down. Number one is health, number two is function, and then number three is aesthetics. But you've got to have that health. And because of what I learned a few years ago, and the information is only growing.
You want to get the word out about how mouth health is tied in to general well-being.
Absolutely. The mouth is part of the body. And this is what we have to understand, that physicians, many of them in their medical training receive minimal instruction about the mouth. Some physicians I've talked to, they spent maybe an hour, maybe one day. That's
No,
tops.
you're exaggerating.
No, I'm not. And you can ask your physician, how much training did you get about the mouth? And they will tell you, well, minimal. But the mouth is part of the body. And anybody who thinks the mouth is not part of the body, tomorrow when you go to work, leave your mouth at home. It's part. It has blood vessels, it has muscles, it has tendons, it has bone, it has nerves, it has everything that every other part of your body has. And the way I try and explain this is, if the factory up the river is polluting the river and you're getting your drinking water out of the river, even if the water tastes good, should you be concerned? Well,
Wow,
yeah, obviously.
yes.
Well, what would you want to do if you knew the water was the factory was polluting the water? Well, you'd want to go clean up the factory.
Right.
Well, we don't have a river in our body, but we do have a stream. It's called the bloodstream. And whatever happens in one area of that stream is transferred through your whole body. So if you have an infected foot, that infection does not stay in your foot. All the bacteria, all of the bad byproducts of infection go into your bloodstream and go through your whole body. The same is true if you have an infection in your hand, your arm, your back, or your mouth. And this is the biggest challenge right here, is that when you've got wounds on your body somewhere, you can see them.
Right.
You can look right at them.
And you do topical and just take care of it.
You
right?
take it because you can look
Right.
at it. If it's in your mouth, it's hidden behind the curtain of the lips, and you don't see it. And on top of that, 95% of dental infections have zero pain. You don't even know you have it. So why would you look for treatment for an infection that you didn't know you had?
That's unbelievable. I mean, we go to the dentist when my tooth hurts. I go to the dentist. You are the tooth doctor. I don't really think of it as almost an organ. I mean, it is so directly connected. How is bacteria getting in there? I mean, is it through?
Well, we need bacteria. If we didn't have bacteria, we'd be sick. But there are good bacteria and there are bad bacteria. When a child is born, for instance, it does not have the bacteria that can cause cavities. It's not in their mouth. How do they get it? Well, from family members, from kissing, from sharing a straw, from wiping off a binky, in your mouth, whatever it takes. But that's how
it's coming from the outside into the
that's
mouth.
correct. That's correct. So so again, when a baby
Wow.
is born, they don't have the bacteria that can cause cavities. They pick it up. But look at all the things we put in our mouth. I mean, you drop something on the floor, maybe kids pick it up, but we end up with a lot of these different bacteria. Not all bacteria are bad, but some of them are.
It's that 5-second rule. That's bad. It's worse than we thought. Here we laugh about it, but it's a big deal.
Well, yeah. Once it gets in your mouth, if it has a nice warm place to go, like in between your teeth and under the gums right there, they're going to just populate. And this is why it's important to keep your mouth clean. If you spit when you brush your teeth and any blood comes out, any blood comes out, you have an infection. Just because it doesn't hurt doesn't mean it's okay. High blood pressure, diabetes, glaucoma, cancer, none of them hurt for years. And all of a sudden you find out, oh my gosh, I've got cancer. How long has that been going on? Well, maybe several years, but you didn't know it. Same thing happens with periodontal disease, gum disease. It's going on for years, but there's no pain. So in your mind, things are just fine. In reality, you're dumping a lot of pus into your bloodstream. That's the big deal. All infections produce pus. What is pus? Is yucky. I know it's that white yuck.
Yeah.
Okay. What is it? It's bad bacteria, dead tissue debris, dead white blood cells, inflammatory proteins, and some other toxins. Where's the pus go?
Wow.
Well, it either drains out or drains in. If it drains out, you see it. When you pop a pimple, that's pus. If it drains in, you never see it. That's the kicker right there. You never see what's happening, but it's being absorbed into your bloodstream. From there, it goes to your heart. It's pumped to the lungs, back to the heart, and then it's pumped through the whole body. So you've got this pus from any infection, and we're just talking about periodontal disease now, gum disease, but that pus is going through your whole body. They've now shown that the bacteria in periodontal disease are causative. This is a huge word, is causative for cardiovascular disease. Research that was published in November of 2016, just beyond a shadow of a doubt. This is one of the reasons, one of the big factors in cardiovascular disease. Well, what's the number one reason for heart attacks? Cardiovascular disease. How about strokes? Cardiovascular disease. So if a hunk of plaque breaks off in your arteries and goes to the heart, it's a heart attack. If it goes to the brain, it's a stroke. And again, it's interesting that we call the buildup on our teeth plaque, and we call the buildup in the arteries plaque. Gee, are they related?
I've never made that connection.
Yeah. And are they related? Absolutely. So how can we, if you have an infection going on inside your mouth for years that is symptom-free, and you're dumping pus into your bloodstream for not just weeks or months, but literally for decades. So when you've had 15, 20, 25 years of impurities going into your bloodstream simply because it didn't hurt, do you think that can have some effect on your overall health? Man, absolutely.
Wow.
Absolutely.
All right, we're going to take a quick break.
Sure.
And we come back, I want to talk to you about why we are just now hearing about this.
Dr. Chuck Reinertsen has been practicing dentistry in Central Florida since 1979, and he believes the health of your mouth is the #1 priority. If you would like to be a patient of Dr. Chuck's and you're in Central Florida, you can call him at 352-253-6400.
Okay, so Dr. Chuck, let's just go ahead and recap. You were talking about how the mouth is tied in with general health.
Right.
And why this is so important. Why are we not hearing about this before now?
I have that same question. I have that same question. There is this, I'm going to call it the deadly gap between physicians and dentists. The physicians are taking care of the majority of the body, but they leave out the mouth. Dentists are taking care of the mouth, but they don't have contact with the physician. So when we find infections in the mouth, ideally we'd let the patient's primary care physician know, hey, they've got an infection in their mouth. Well, generally speaking, dentists don't do that. When a physician has a patient and they've got an infection going on, they have an elevated white count, and they're trying to figure out where's that infection coming from, it would be a really wise idea to at least rule out oral infections to where you could have the physician refer the patient to a qualified dentist and then get a report. Is there infection? Is there not infection? Are there airway restrictions? Is there bite problems that could be causing headaches? I mean, the mouth is part of the body, and it has effect on the rest of the body. So it would be nice if physicians could at least rule out the mouth as the source of the infection, of the bacteria. Then you can start treating the source, not the symptoms. And that's one of the challenges we have in medicine today, is so many times we're treating the symptoms and not the source. Well, here, rub this on, it'll make that blotch go away. Well, the question is, why do I have the blotch? What's going on? If I drive my car and the red light comes on, I can either put a piece of black tape over the red light.
You're not supposed to do that?
No, you're not.
Okay.
Or you can figure out, gee, what's going on? What's really happening?
Right.
And this is where we need to get to the source. And I'm afraid that we're going to find the source of many diseases is right under our nose. I mean, it's right there. It's right in your mouth. It's behind the curtain of the lips. And
well, I think we need to dive into that more. Let's go ahead and make that the second show, because you have a lot to share about that. In the meantime, what can we do? Just hearing the very first episode of, Your Filthy Mouth, what can we do to help start to protect ourselves from what's going on in our mouth?
a real simple thing, and this is easy and cheap.
Okay, I like that.
Yeah. Plaque is the same color as our teeth. So when you brush your teeth, many times you look in there, you see it, oh, it looks great. Okay, I'm good. That doesn't mean you got all the bacteria off your teeth, all the plaque off your teeth. There's a solution called disclosing solution or disclosing tablets. A lot of people had to use when they were kids in school. They would chew up these little...
Oh, they were fun, pink or blue.
Yeah, there you go. There you go. Yeah, and that would mark wherever
you
you missed. This is something that we're doing in our office with every patient, with our whole staff, with me, because in our minds, we've done a great job cleaning our teeth. But in reality, we haven't. So if you could just go to the drugstore and buy some disclosing solution or tablets, it's over the counter, and then go home and brush your teeth, floss your teeth, irrigate your teeth, however you're going to clean your teeth, do the best job you can. Then chew up one of those tablets, look in your mouth, don't be afraid to use a flashlight, pull your cheeks back, and see what's left on your teeth. That's bacteria. That's the stuff that gets down into your gums, gets into your bloodstream, and affects the rest of your body. So if you can get that off, this is an educational thing. If we can head them off at the pass, if we can get the bacteria out of your mouth before they get into your bloodstream, we've prevented many issues. And that, to me, is the most effective way of dealing with a healthcare crisis, is not treating the disease, but preventing the disease. And that's one of the things we want to work by people really working to make sure their mouth is clean. What's cool is we'll give these to a family, and the parents and the kids will have competition to see who's doing a better job. And it's amazing how many times the kids are doing a better job than mom or dad, because it's fun.
I think we need to encourage our new listeners here to Your Filthy Mouth to go on the podcast site, filthymouthpodcast.com, and take those tablets and let's see those pictures, and we will start to post them on your page.
That would be wonderful.
I think that'd be great.
Yeah, it's an eye-opener.
It's amazing. I'm going to buy them today.
Yeah.
So outside of brushing good and flossing, what are some other things? I mean, I see that you've got tonics that you offer and all kinds of extra over and above.
There's more than one right way. There's many more than one wrong ways. So to me, I'm not hung up on technique.
Not the up and down, the side by side, the 30 seconds.
Oh, when I was going to the dentist when I was in high school, I got frustrated. Every time I went to the dentist, they had a new way of brushing your teeth. Okay, at first I would just scrub your teeth. Okay,
right.
Then it was no, you got to go up and down. No, you got to go back and forth. No, you go down on the uppers and up on the lowers. No, you got to go in a circle. No, you got to aim 45 degrees into the gums. You
I'm laughing because I've heard all of those. Yes.
Yeah. And I'm not hung up on the whole idea is to get the bacteria off of your teeth without damaging the tooth or the gums. And if I look in someone's mouth and it looks beautiful, and I say, how do you clean your teeth? And they say, well, I have an old sock I put on my finger and just rub over my teeth. I'll tell them, don't lose the sock. I'm not hung up on how you do it, but you've got to get the bacteria out of it. You got to head them off at the pass. Mm-hmm. And this is the entry point for so many bacteria is through the mouth. If you have open wounds on your body somewhere, that's an entry point. If you don't have open wounds, most of it comes in through the mouth. And that's why we need to make sure the mouth is clean.
Wow.
Yeah. But those are some things you can do right there. So with the disclosing tablets, check your mouth on that. I'm not hung up on a lot of rinses. People keep looking for
Like the magic rinse.
yeah, the magic rinse.
It's
I'm just going to take this pill
right.
or use this rinse and everything is going to be fine. No,
Right.
you still have to get in there and clean things up good. And
Mm-hmm.
don't be afraid to look. Pull your cheeks
Mm-hmm.
back. Use the flashlight. Get in there and look. But if you can get good at that, you're going to save yourself. Oh my gosh, prevention isn't sexy, but it
Mm-hmm.
saves time, money, and pain. Those are
Mm-hmm.
three things that none of us want. So
Mm-hmm.
if we can take those extra steps in prevention, we're going to save thousands and thousands of dollars. We're going to save many, many hours, and you're going to save pain because when the infection is there long enough, it will,
Mm-hmm.
most of them will at some point give you pain, but it may take years and years before it gives you pain.
And who knows what's happened through the bloodstream at that point.
That's the key right there. You got it.
Wow.
You got it.
Okay, so I'm confessing I floss my teeth twice a year, and that's when I go to you, go to the dentist, because then you floss for me. I mean, how important is that? Is that really helping the bacteria? Is it?
When people tell me they floss religiously, I realize that means Christmas and Easter. So
That's awesome.
so yeah, flossing is good if you floss right. The trouble is most people don't floss right. Most people pop. Popping is when you just pop the floss in between your teeth, you wiggle around a little bit, you pop it out, and you go to the next space. That's popping.
Mhm.
Flossing is where you go in between the teeth, you wrap the floss 180 degrees around one of those two teeth, you slide the floss up and down 5 or 6 times, then you wrap it around the other tooth in that space, slide it up and down 5 or 6 times, then pop it out and go to the next space. What you've done then is you've loosened up the bacteria, but you haven't gotten it out of the mouth. And this is why I'm such a huge fan of directed water irrigation. Whether you use a water pick, you use a shower breeze, you use any type of these interdental water jets. But the trick on that is you want to hold the tip of that water jet directly in between the teeth for a minimum of 5 full seconds. That's a long time.
It is a long time.
1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi.
It really takes that long for something to unlodge?
Well, there's something called the Venturi effect. Whenever you have a flowing fluid, it creates a negative pressure or a suction right next to it. When you shoot that water directly in between the teeth and you let it sit there for 5 seconds, you actually create a suction under the gums and you suck out the bacteria. So it's
Okay.
not a power wash. You're not blasting it out. And that's why you don't aim it along the outside edge of the tooth. You don't want to shove things under the gums. It's just in between, just from the outside to the inside. You don't have to do from the tongue side to the cheek, just from the cheek to the tongue side. All the way around, top and bottom.
Okay, I know that one of our podcasts soon has to be proper brushing and proper mouth care because you have a lot to say on that.
Yeah.
I mean, that's amazing. Okay, Dr. Chuck, it's time to answer a question.
Hey, Dr. Chuck, this is Jim. There's all kinds of different toothpastes out there and fluoride and whitening and things like that. Is there any kind of toothpaste you recommend?
There are so many toothpastes out there. When you go by the toothpaste aisle and you have a
It's
hard time.
crazy.
Yeah, it's nuts. It's
Yeah.
nuts. And by the way, these toothpaste companies have wonderful marketing programs.
Mhm.
So that's good.
Mhm.
I recommend just a regular toothpaste. I do not like the tartar control or the whitening type toothpaste
Really?
because they create sensitivity on many, 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 many patients. I'll have someone come in there, yeah, my teeth are sensitive now. I said, well, what toothpaste are you using? Well, we just switched to this, whatever. I said, well, does it have tartar control or whitening in it? Oh, yeah. Well, switch and go to one that doesn't have it. You can use Crest cavity protection or just the regular Colgate or just the Sensodyne is wonderful. Any of those that don't have the whitening or the tartar control. Those will help, again, to get the bacteria off your teeth. But there's not any one magic toothpaste. You've still got to get in there. You've got to brush the teeth. You've got to remove the plaque. It sticks to your teeth a lot harder than you think. And that's why when you use the disclosing tablets, that's when you get those oh shucks moments when you look inside there and say, but I just brushed there.
Right.
How could that still be there? Well, because it's holding on stiffer than you think. Now, when I say stiffer, please use a soft toothbrush. Don't use a stiff toothbrush because you can put notches in your teeth. You can do a lot of damage on the gums with a hard toothbrush. Soft toothbrush is the best. I really recommend electric. I'm not hung up on any particular brand, whichever one. Buy the one you're going to use.
Right.
Don't
Right.
buy one that's going to sit on the counter. Buy the one you're going to use. But and then take the time. You cannot properly clean your mouth in less than 5 to 7 minutes. Ooh.
Wow.
Ooh.
That's
You cannot
a lot
properly
of
clean your mouth in
time.
less than 5 to 7 minutes. If you have an hour and say, well, I think I'll go paint the house. Well, you can slap some paint on the wall, but you're not going to do a good job. The average person spends 30 seconds or less brushing their teeth. 30 seconds or less, because it's behind the curtain of the lips and you don't see it, and plaque is the same color as your teeth, and as long as you don't feel any food hunks in there, you figure it's okay, and that's not really true.
Some of us just brush our teeth so that we have healthy breath. That's
Yeah,
it, so
yeah.
we can kiss our spouse at night.
And that's a lot of things. They just give
Yeah.
you better breath, but it's
Yeah.
not taking care of the problem.
Right.
But you really need to spend some time in there. Electric toothbrushes, some of them have a 2-minute timer in the handle where every 30 seconds it gives you a little beep or hesitation in the motor, and to change sections in your mouth where you're cleaning. If you're using the water irrigation in between your teeth, if you do the 5 seconds in between each one, there you're using some of the time. But you've got to spend that time one time a day. I'm not going to tell people, oh, you need to brush your teeth 3 times a day or even 2 times a day. I'm going to say you need to brush your teeth properly. You need to clean your mouth properly 1 time a day. Now, anything above that is gravy. That's wonderful. But if you do it wrong 3 times a day,
Wow.
okay, you're not doing yourself much good. If you do it right 1 time a day, you're doing good. If you do it right 1 time a day and wrong 3 times a day, you're still doing great. And you got your good breath, things are good, but you're not. You're able to get the bacteria off your teeth without damaging the tooth or the gums, which can cut down on a lot of other diseases. So 1 time a day right is way better than 3 times a day wrong. I have people come in and you do an exam on them. And they say, oh, I brush my teeth 3 times a day. And you look in there, so, well, you brush something. But I don't think it's all your teeth. Over here you're getting really good, but this area you're not even touching.
Right.
So it's not a matter of who's right, but what's right. And that's you have to get the bacteria off. They have no emotions. Bacteria don't care. They don't care what you're going through. They don't care what's going on in your life. They don't care about your finances. They don't care about your family. The bacteria are going to go in there and do the damage that they're going to do regardless of what you're going through personally. They have no emotions.
All right. Well, we're kind of running out of time. And remember in the beginning, I said we should be toasting. It's our inaugural show. Well, I have a little surprise. I brought some champagne.
Oh, my gosh.
Now, I know it's early. We're recording this morning, so we can't drink too much because we have another show to record. But I'm going to have you do the honors so that we can toast.
Well, thank you very much.
Well, thank you so much. I mean, we have so much to learn about this.
I do talks to different groups, and one of the topics is my teeth are fine and other misconceptions. Because a lot of times we think if nothing hurts, it's fine, but that's just not true. So we all have misconceptions. That just happens to be one of them.
Here's to breaking those and many wonderful shows coming up.
Thank you.
Thank you,
Thank you
Dr.
so
Chuck.
much.
Oh, that is good.
Oh, that's wonderful. That's wonderful.
Thanks for listening to Your Filthy Mouth. You can follow Dr. Chuck on Facebook, Twitter, LinkedIn, and YouTube at Your Filthy Mouth, or go to our webpage at filthymouthpodcast.com. There's a lot of fun, interactive things going on there. As a matter of fact, look for the Ask Dr. Chuck button, and you can record a question right from your computer. Or email your Filthy Mouth related photos and questions to filthymouthpodcast@gmail.com. And please be sure to rate the show on iTunes. It really helps us out a ton. And subscribe to the show so the new episodes automatically come to you. And if you're in Central Florida and you'd like to be a patient of Dr. Chuck, or you'd like him to speak to your group or organization, please call him at Lifetime Dental in Tavares, Florida, 352-253-6400.